start with news from the World Health Organization. It has warned that the Ebola outbreak in the northeastern Democratic Republic of Congo could worsen rapidly because of violence, community resistance to treatment, and the geographic location of the epidemic. At least 100 of the 150 confirmed cases have died in North Kivu and Ituri provinces.
The Ebola response is at a critical juncture. Although the number of new cases has fallen in the past few weeks and nearly 12,000 people have been vaccinated, there are major obstacles ahead.
We are now extremely concerned that several factors may be coming together over the next weeks to months to create a potential perfect storm. A perfect storm of active conflict, limiting our ability to access civilians.
The World Health Organization is also concerned about how politics is affecting the response to the outbreak.
We also see a very concerning trend, that resistance, driven by quite natural fear of this terrifying disease, is starting to be exploited by local politicians, and we're very concerned in the run-up to the elections projected for December that exploitation of this very natural fear will gather momentum and make it even more difficult to root out the last cases of Ebola.
The attacks by armed groups have increased in severity and frequency, especially in Beni, where the WHO's main operations are based.
Yesterday, we were only able to reach 20% of the contacts of confirmed and probable cases in and around Beni. So it means that 80% of people that are at risk of Ebola, at direct, immediate risk of Ebola, were unable to be followed up.
The city has declared a period of mourning until Friday as the WHO suspends house visits to potential patients.
So that means this entire week we may have cases that become more symptomatic and become more infectious that we're unable to respond to.
Authorities say many of the new cases are among communities who are resistant to vaccination campaigns. Beryl Oro, CGTN.
The Congolese Health Ministry has directed health workers in Beni City to suspend visits to suspected Ebola patients. The directive was issued after a rebel attack in the eastern DRC city left at least 16 people dead and several others injured. A statement from the Health Ministry says the suspension is temporary and only applies to field activities that require health workers to visit households. Other areas of the Ebola response are reported to be operational. The locals in Beni recently staged a protest to express their disappointment with the government for failing to protect them during the rebel attack. The UN asked its staff to stay home to avoid confrontations with the angry residents. Health workers in the DRC are facing serious challenges of containing Ebola because of the insecurity in the area. According to the World Health Organization, 100 people have died of Ebola in North Kivu province since the start of August. Authorities in Beni suspect the Allied Democratic Forces to have carried out the attack in eastern DRC. Chris Ochamringa, CGTN, Kinshasa, Democratic Republic of Congo.
Well, the World Health Organization says the deadly Ebola outbreak in the Democratic Republic of Congo is about to become the perfect storm. The World Health Organization says fighting in the country has halted efforts to curb the outbreak that's killed more than 65 people in the North region. Now that violence is escalating, the country must now brace itself for a spread of the life-threatening disease. For more on this, earlier we spoke to geographic. He's the spokesperson for the World Health Organization.
Right now, the response to the Ebola outbreak in North Kivu is facing several challenges. We have a worrying security situation. There were security incidents in past weeks in Beni, and Beni is the base from which we operate, and we go to places where we know that there are confirmed cases of Ebola. The security situation made us stop working right now in Beni, although we are able to continue to operate in other areas like Mangina, like Butembo, like in Ituri province, where there were also cases. Also, the other issue is that we have now cases that are relatively far away from the original epicenter of the outbreak, which means then that we need really to get to these people and put in place all the containment measures such as contact tracing, vaccination, safe and dignified burials. We need also to make sure that people are diagnosed and that we work with the communities. And the reason why we are seeing these cases further away from the epicenter is that some small percentage of the population did not really accept Ebola response measures, so people were going away from response teams. They were fleeing to other areas where they would fall sick, and then we have to go there and find them. So all these factors make that the response is a very critical juncture right now, and we hope that we will be able, together with the Ministry of Health and other partners, to go back on work in Beni, but also everywhere else, go back to community and try to contain the further spread. Well, for WHO, we are really focusing on the response to the outbreak. Ebola is a threat to everyone, to all the groups that exist in this area, and this is the message what we are trying to pass, that Ebola can affect really anyone in any of the communities, and we need really to work all together to try to stop it. We know what needs to be done. We need to have people who are sick going to treatment center, so their chances of survival are increased by receiving appropriate treatment, and also remove them from communities so they don't infect their loved ones. And this is something that requires full engagement from the community, and it requires us to go inside those communities and do that kind of work. This also includes vaccinating people who are at high risk, also treating people with the new treatments in the treatment centers. So I think that our message is very clear, that we call on everyone to ensure that full access to all communities, and we call on community to really engage with us and work together with us.
Well, let's get more now from DRC's neighbor, Uganda, on plans to avoid the spread to the country. CGTN's Michael Beleke is joining me now from Kampala. Michael, we just heard that the World Health Organization is saying that the deadly Ebola outbreak in the DRC may spread. So Uganda has been on high alert now for a while. What are the plans? What plans are in place if the DRC outbreak spills over into Uganda?
Hi, Beatrice. Uganda's Ministry of Health and, of course, with partners like the Red Cross and WHO, with the UN Refugee Agency, have been able to set up isolation camps in all districts bordering the Democratic Republic of Congo. These are about 5 districts along the border. They have stepped up efforts to screen persons entering the country with standby ambulances at all official border crossing points, just in case an Ebola suspect arises. The most important, of course, has been the information given to communities along the borders on how to identify Ebola signs and symptoms, what they should do and what they should look out for in case they are faced with such a situation. Beatrice?
Well, Michael, Save the Children organization says 2 new cases have been reported on the border with Uganda. Any confirmation on this?
Yes, the Ministry of Health has confirmed this. They say that last week, that was on Wednesday, someone died on the other side of Lake Albert. Lake Albert is along the border between Uganda and DR Congo. So on the other side of DR Congo, there was a contact who died on September 19th, and this was at a hospital which was quite close to the lake side border. Apparently, the deceased was in contact with previously 2 confirmed cases, a sister and a mother, I think, and there is a high risk the disease could spread, and this is what health officials are worried about as a result of population movements across the border due to the recent insecurity in the areas, as we heard from WHO. the country, there are many people, because of the recent attacks, there are many people that are fleeing to Uganda to seek refuge. And well, the country has tried to buy some heat scanners now placed at all official border points to screen people walking in. But however, there's a situation that comes up. There's a porous border where there are walkways, people just walk in, and some of these are footpaths, which is becoming a very big challenge at this point. Beatrice?
And Michael, finally though, has there been any exchange of ideas between the DRC and the Ugandan government on how to save this situation, or is Uganda acting on its own?
Actually, Uganda was working closely with the DRC. Just to take you back a bit, Uganda faced such a situation just in the districts of Mundubujo along the border with DRC some years ago, and it successfully contained Ebola previously, and it was all taken away from the communities. And so at this time, Uganda is a key partner, and it has expertise to handle the situation in the east of the DRC. The challenge, like I said, remains now the recent attacks from rebels, or from the Ugandan rebels and other militias within the DRC. And this is a problem because now the WHO and other organizations have suspended activities, which definitely is going to bring in more people running to Uganda. And the fact that these contacts cannot be traced, they cannot be found, and it's going to be a very big challenge to contain the disease. And this is why Uganda is on top of its game at a point like this.
All right, Michael Baleke for us there in Kampala. Thank you.